Hi.
Hi.
How are you?
Good. I'm good.
Thank you for coming in.
No
I also want
problem.
to thank you for filling out and signing the consent form for our telehealth session that we're having today. So, Catherine, tell me, what's the reason for your visit today? What's going on, my dear?
I'm having some sensitivity issues, and when I'm having some colds, I'm getting the sensitivity, and I feel like when I'm brushing my teeth, I'm having some bleeding, some inflammation.
Okay.
I do floss, but it's a few times a week. I have a
Okay.
very busy schedule, so I'm always in a rush.
Oh, tell me, what do you do for a living?
So I actually work in finance, so it's very stressful. I go
Stressful.
out for a cigarette about every hour.
Okay.
But I'm not ready to quit yet. I'm very dependent on it. I feel like it helps with my anxiety and it helps me relax.
I see.
So one day I'll quit, but right now I don't feel like I'm ready.
Okay, don't worry. We'll cross that bridge once we get there. So I'll discuss with you at the end of our session what we can do to help you out, okay?
Okay, thank
So
you.
let's see. I'm gonna go through your medical history quickly. Um, okay, so I have here that the last time you were seen in a dentist was over 2 years ago.
Yeah.
You had some high blood pressure, but it's controlled.
Yes.
I see you do have some dental anxiety that you charted for me. Okay. Let's see your X-rays. The last time you took your X-rays, that was also about over 2 years ago.
Yeah, I haven't had a chance to go to the dentist.
Okay. And I see you provided for me your intraoral X-ray you took a week ago. Very good. So I'll be able to take a look at that much closely. I also saw you have a herpes lesion around your labial commissure in your lower lip. So we'll monitor that.
I think from stress, really.
Possibly. Okay, so we'll monitor that for about 2 weeks, and your next visit, we'll take a look at it and see if it has improved.
Okay.
Okay, so we're going to go over your findings together and see what we have here, and I'll be able to give you some recommendations in a way to better your oral health and some pointers, okay?
That sounds good.
So in the last time you were in our office, we did some perioprobing, if you remember, and we applied that disclosing agent onto your teeth.
Yeah.
And that the solution that we brush on your teeth, it actually shows the bacteria that has attached itself, where you have the old and new bacteria you can differentiate. So I will tell you and show you ways how to floss and brush your teeth to help you get as much bacteria off your teeth and disrupt the acidic environment that is creating.
Okay.
And if you remember, the perioprobing that was actually done, we did see some bone loss and there was some recession. Most of your pockets were around 3 to 4 millimeters in depth, and around your anterior and your mandibular posterior teeth, there were some around 4 to 6 millimeter pockets.
Yeah.
And probably why those areas are harder for you to floss, because they're deeper than your other sides, which probably caused you to have the deeper pockets. And I see around your crown on tooth number 13, you did mention some sensitivity.
Yeah, I do have sensitivity around my crown, actually. I get a lot of sensitivity. That's what I was talking about, the cold.
Okay, so
when I
that
have
could be
cold
why,
feet.
because I did notice some recession around your crown area. It looks like you also may have some bone loss that's starting to come about. And is that where it's also difficult for you to floss there? How's your flossing on that side?
It's a little difficult to get back there, so I don't really floss that much in that area.
Okay, so we're going to show you how to try to get in between the contacts where your crown is, okay?
Okay.
Not many people are aware, but the food that you actually eat also does affect your overall oral health. The food that you're eating, the bacteria is all in your mouth, is also consuming that food, which is also causing an acidic environment, which can lead to cavities, which can lead to inflammation, gingivitis, possibly at the end will result into bone loss and then having periodontitis. I mean, you're not there yet. So if you don't improve your techniques and take into consideration what I'm about to teach you, unfortunately, it might lead to there. So before I'm going to show you proper techniques that I recommend for you to use, how about you show me what you do? What do you do at home?
So I have like this brush. It's like a plain brush.
Okay.
So I just go like this,
Okay.
and then like this, and then like this. Hi.
Okay.
And I scrub some more in the front because that's the teeth that you can see, and I want them white, and I'm a smoker. So I just do this, and that's it.
Okay, so now I'm going to show you the proper technique that I would recommend my patients to do at home, okay? Okay, my dear, so I'm going to recommend you to use a soft bristle brush that's cross action. For example, I have some here to show you by Oral-B. And this is what we're gonna do. The technique I recommend for you to use will be Stillman and modified Baz. So I have a little handy little guy here. So we're gonna start with the back molars, slowly in circular motion, not too rough. You're a little bit going too hard there, so I would say go softer on your teeth. You don't want to have abrasion from excessive toothbrushing really hardly. And as you brush, circular methods, 45 degrees towards the gums, this will help with inflammation.
Okay.
Go around, circular motion.
Angle towards the gums.
Angle towards the gums the entire time.
Okay.
And then don't forget to get your occlusal surfaces. Same thing for the bottom. So modified Baz technique, you're also going to go in circular motion. Now, 2 to 3 teeth at a time. Circular motion. Let me show you, I guess, the side. 2 to 3 teeth at a time. Circular motion. And then you're going to thrust, sweep, down. Continue. Sweep down.
Okay.
The same thing throughout your entire arch. Circular motion, thrust, sweep down. Throughout the entire way. Same thing on your mandible. Okay, so this will help stimulate circulation to the gum area and help decrease your sensitivity that you have even around your crown area. So be very careful and gentle to avoid any inflammation. All right, I'm also going to recommend you to floss with wax dental floss to remove and disrupt the bacteria that's causing the inflammation that you're having in between your teeth. Also, I'm going to recommend you to use Oral-B Super Floss. It's a little bit tougher, but it's also very good. So either way, you can use those. I'm going to quickly show you. So I'm going to show you how to floss. Basically, you're going to wrap it around your middle finger very tightly. Make sure you have some space. Use your index fingers to help you. And go in between the teeth. In and out, in and out. And make sure you do a C shape. And take it out.
I think I could do that.
Don't be too rough. Don't let it pop out. Slowly wiggle it out. Okay? Okay, I will also prescribe you the chlorhexidine mouth rinse. Okay? This will help you with inflammation and bleeding. You'll be able to use it twice a day, after breakfast, before bedtime. Swish for like a bit, 60 seconds, and spit. Don't drink right away after. Okay? Let it do its job. So I really hope you use these techniques to improve your oral health. Like I said, if you have any questions, feel free to call me. I'll be glad to help you out. And we'll set you up for your next 3 months appointment. And we'll discuss then some options to help you quit smoking. For now, I'll actually email you a brochure. I have a really good brochure that has some benefits of quitting, and it will also include a helpline or websites to help you do your research on how to quit. And it will also include some FDA prescribed pharmaceuticals that can make it a little bit easier for you to quit. Just know that I'm here for you. So anytime, feel free to call me. Do you have any questions for me?
Not as of right now. You helped me a lot. I will take the brochure. I'll definitely take a look at it. I will consider it. For now, I know I'm not going to be able to quit, but I do want to quit along the line. I want to see my kids grow up.
Okay, so I hope when I see you in 3 months, we'll see a great improvement in your overall health. And if you need some more help with techniques, I'll be happy to help you out.
Thank you.
Okay?
Thank you.
It was great seeing you, and I'll see you in 3 months.
Yes,
Take
bye.
care. Bye.